Hey, good morning, everybody. This is my second video as an official YouTube content creator here, but I thought I'd give you guys a little rundown on what to expect when you are scrubbing in with me in surgery lab. I know it's been a source of anxiety for everybody, but in case you didn't get the benefit of being the person that was present during the walkthrough, I'm going to run it down for you. Maybe hopefully relieve a little bit of that anxiety. All right, what do we do first? My favorite thing, wash your damn hands. So we're going to scrub, and we're going to scrub better than you have probably ever scrubbed your hands before in your entire life. One thing I would ask, though, is that as we go to the scrub sink, please be sure that you have on your cap, your mask, that your hair is pulled back, and you have on shoe covers. And I'd also request that you make sure that I have my cap, my mask, and my shoe covers on as well, because I will occasionally forget that. Also, make sure that your mask is comfortable, because from that moment forward, you are not going to be able to touch your face. Each of us is going to grab a new surgical chlorhexidine scrub brush, and then as you open that pack, there's a tiny little fingernail cleaner in it, and so you clean underneath your fingernails. I would love for your nails to be short. Ideally, best practice in the OR is no nail polish and no press-on nails, no fake fingernails, something that shocking. I know this will shock you, but I have never had them. But I would request that you don't have fake fingernails in, because actually under your nail beds and under your fingernails is really one of the highest places for bacterial contamination to occur. So starting at the fingertips. So we're going to start from this moment forward. As you're scrubbing, your hands should always be above your elbows. And we're going to start after we clean fingernails. We're going to start right at the fingertips and using that scrub brush basically 10 times. So 10 is the magic number. So 10 times the tip of the fingers, 10 times the tip of the thumb. And then every finger basically divided into 4 surfaces. So 10 times, 10 times, 10 times, 10 times on each of your 5 fingers and your finger webbing. Then front of the hand, back of the hand, and we're going to work your way all the way down to about 2/3 of the way down your forearm. Then we're going to switch and do it on the other hand. So 10 times, 10 times, 10 times, all the way down. Get your hands clean. Then the sink will be running. We have warm and cold water. It's a knee. If you guys haven't ever looked at that surgical sink, it is a knee lever press to get the sink on and off. We're going to rinse the soap off. And you start at the fingertips and you let that water run all the way down your arms and drip into the sink. From this point forward, your hands are not going to be touching anything, and they need to stay in this space essentially between your neck and your belly button. So always above your elbows and right in front of you. So that is the basics of a scrub, and in theory it should take about 10 minutes. It usually really honestly takes about 5. All right, getting the gown on. So this part can be tricky. Someone will have opened our gown pack for us as we step into the counter there. There will be a huck towel or one of those blue towels in the pack. And your gloves should also be open in the pack. If they're not, someone can come and open them after you've dried your hands and got your gloves on or got your gown on. So you pick up that towel by the little tabbed edge. Each one of your hands and forearms has one side of that towel. So when you are drying your hands, it's more of a blotting your hands dry than a vigorous rubbing of your hands all the way down to this side on this hand. Grab it, use the other side, this side, blot your hands completely dry. You're going to drop that towel on the floor. So get your towel dropped on the floor. Then we're going to do kind of the same thing with the gown. So you're going to pick your gown up at the tabbed part. You want to step back from the counter at that point, because you got to let that gown go down, and then you got to figure out where the armholes are at and shimmy your way into that gown without the gown touching the counter, without the gown touching the wall, without your arms touching the counter, without your arms touching the wall or the operating table. So once you get your arms into that surgical gown, here is the thing I want you to know. Your fingertips should not come out of those gown arms until you have your gloves on. Because keep your hands and your fingers in the sleeves. No fingertips poking out, and somebody is going to come tie us in. It's going to be either one of your classmates or Shauna or Brandy will tie us in. Then closed gloving. Holy crap. This is probably going to be the hardest thing that you do with me all day. So the gloves will be open for us in the sterile gown. They're in a folded package. You're going to unfold them, and your hands are going to be like this. Your hands are going to be in your sleeves. So you're unfolding them like this when my fingers are not peeking out. So we're going to open that up, fingers of the gloves facing away from you in the package. Then we're going to pick the glove up, point the fingers towards you with the thumb side down. Then you're going to grab it right here and pull it up over your hand. This is tricky. I know you guys practiced in class. I would highly encourage you to go ask me for a set of expired gloves that I'll get for you out of the dispensary. I want you to know your glove size when we get in there too. And pull that all the way over your sleeve. That surgical glove should completely cover the cuff of your gown. Once you have that over, then you can use this other arm to kind of figure out where your fingers are. Get your fingers all the way up and in it. And then we're going to repeat that on the other side. Now, I am okay with a slightly different way of closed gloving than what you were taught in class. Sean and I discussed this yesterday. I will show you, and I will help you get your gloves on through this. Once you have them in and on, again, your hands need to stay right here in this area. So ideally clasped, so you're not touching anything. You do not want to drop your hands. You do not want to contaminate anything about your sterile field through here. You don't want to turn your back to the OR. You don't want to turn your back to anybody. Basically, you have the right of way once you've got your gloves and your gown on. Now, surgery table. I'm going to be on the right side of the patient's right side. You're going to walk around the table and you're going to stand on the left. Do not let your hands or your body touch anything that isn't sterile. So you need to make sure that the drape that's covering our pack initially, someone will have opened that for us, that it's all the way over the edges of the table. As we get into there, you're going to open that surgery pack, the inner drape, and arrange the surgical instruments. And I don't care how you arrange them, honestly, but I'm going to tell you I'm going to need those towel clamps first, and I'm going to need the Mayo scissors first. And then the next thing that I want you to do is to do a sponge count. So you're going to count the gauze that are in the pack, and there should be 20 to 0 of them in that pack because we need to make sure that they're all accounted for at the end of the surgery as well. You're going to ask for a 10 blade. Someone's going to drop a 10 blade onto the sterile field. You are going to pick that up with some hemostats or your needle drivers, and you're going to put that on the scalpel blade for me while I am draping the patient in and applying the towel clamps. All right, in surgery, I'm going to do my best to remember to use you and ask for instruments. That's a little bit of it's challenging for me because I usually do spays and neuters by myself, which is what most vets are able to do. But we are here for an educational opportunity for you guys to be a sterile assistant. So what are my expectations during surgery? Certainly that you pass me the instruments. I don't care if the box locks are open or the box locks are closed. I do care that you don't put the sharp scalpel blade portion directly onto my hands or gloves. But I do expect you guys to know and review the anatomy of your reproductive organs for the sex that we are performing surgery on. So if you were in there, if you're scrubbed in on a spay with me, I'm going to expect you to know the ovary, the uterine horn, the broad ligament, the suspensory ligament, the proper ligament of the ovary, the body of the uterus, the cervix, all the things that the ovarian pedicle, which is the artery and vein, all the things that we're going to be removing. I want you to know. I may also ask you what this organ is. So be prepared and review your abdominal anatomy with a special focus on the reproductive organs before we go into surgery. And I kind of wrote you a little list here of what to be able to identify for sure. Now, as you're assisting, the single biggest thing that I ask is that you just follow my lead. I will give you instructions as I need your assistance. So I'm probably going to have you holding and stabilizing the pedicles and holding the clamps while I tie ligatures off. I may have you cut the vessels or cut the uterine body. I will tell you exactly what to do every step of the way as we're doing it. And I'm probably also going to have you cut the sutures for me. Now, once we have our reproductive organs removed from the body, you are going to pick that entire thing up in situ, and there's going to be a lot of clamps on it. You're going to move it over to the surgery table. After that, we're going to look really, really closely and make sure that we don't have any excessive hemorrhage anywhere. And once I'm happy with it, then we're going to start our surgical closure. And we're going to be communicating with our anesthesiologist the whole time. So as I start to close, what I will have you do is repeat that sponge count. Again, we're going to make sure that we did not leave any sponges in our patient. And once we are completely done, meaning once everything is closed, sometimes we'll apply, most of the time we'll apply a little bit of surgical glue because we're going to do buried or intradermal sutures on all of our patients because they have to go back into a kennel situation. I want you to remove those sharps from the table. That's a biggie for me. I want the scalpel blade off. I want all the sutures and needles accounted for and into the sharps so that your classmate coming behind you, or you, if it's you in practice, does not accidentally get a needle stick injury or a laceration from picking up all of those instruments. So once we've done that, you got your sharps off the table, then we can step back and take a deep breath, because if you're scrubbing in with me, you're also going to be responsible for recovering your patient. So you're going to move towards the OR. And if that patient's waking up quickly and you need to go recover, I will get the sharps off the table. All right, so what's the worst thing that could happen? Because I know this is a really anxiety-provoking event for everyone here. We could, let me see if I can move my head. No, I can't move my head. We could have a problem in anesthesia. Well, that sucks, and it does happen. I am confident it's not going to happen. When you are scrubbed in, you are responsible for what is going on in that patient surgically. You're not responsible for what's going on anesthetically. If there are problems, we will be aware of them, and I will give orders as need to, because we already have our emergency drugs calculated. We have very competent people in that OR with us running our anesthesia. What happens if you drop an instrument? Don't panic. Just let it go. I drop crap all the time. Particularly thumb forceps seem to be what I really like to drop the most. If you contaminate yourself, but if you accidentally touch a non-sterile surface or you accidentally poke a hole in your gloves, we are going to get your gloves and or gown changed when that happens. Same story if your glove breaks, because sometimes gloves break, especially when you're learning how to closed glove. Worst case for me as a surgeon is, what if we have unexpected hemorrhage? I am likely going to swear. You guys are probably all aware of that. But the biggest thing is just follow my lead. We'll probably extend the incision. We are probably going to get more gauze, which is going to necessitate another sponge count. And if that happens, I'm going to need your help. But I will tell you what to do every step of the way, and just be prepared to follow directions. Don't panic. I'll be the one doing the panicking. You don't have to panic, but just be prepared to follow directions and do exactly as I say. All right, last thing. Do not lock your knees. Please, for the love of God, do not lock your knees. The OR is a super common place for people to pass out, and I don't want you passing out into our patient or into our surgical field. You don't have to be embarrassed if you're feeling faint or feeling sweaty. It's a really different experience if you've never been in a gown, in a mask, in gloves, and under the lights with the heating element in a tight, we've got a small OR, we got a lot of people in there. So if you are feeling faint at any point in time, I need to know, and we're just going to have you step back and step out. Ask any questions while we're in there, please, please, please. I like me some questions, for sure. Please don't hesitate to ask any questions that you may have as we go along. Every surgery may be a little bit different too, because sometimes we'll open something up and we'll find something completely unexpected. But please be sure to study up on your anatomy before we get in there, and I'm looking forward to it. We're gonna have a good time.